Good afternoon, everyone. I'm Dr. Tamara Raveline, Superintendent of Visalia Unified School District, and I will be hosting our Q&A session this afternoon. Today we'll be discussing our preparations for returning to school on Monday, and we're going to especially focus on our health protocols and ventilation. As we return to school for in-person instruction, we want to make sure that our families, staff, and students feel comfortable knowing all the procedures. So some of these that we'll cover today will be review. Again, we are returning to school on Monday, December 7th for our preschool, kindergarten, transitional kindergarten, grades 1 and grade 2 schools only for those families who chose to return to in-person instruction. Throughout this time, we have continued and we remain in constant contact with our local health authorities. With the protocols and procedures that we have put in place in our waiver and our reopening guide, we have made sure to provide the highest level of sanitation and safety possible for our students and staff and the safest environment possible for in-person learning. So today I am pleased to have Susie Skaden, Director of Health Services for their district, and Eric Kerrer, Chief Operations Officer for Visalia Unified School District, joining me. Thank you both for being here today. Before we get into some of our specifics, I want to let everybody know that I have been spending a lot of time listening to Dr. Mark Galley, who is the Director of State and Human Services for the state of California, and Dr. Erica Pond, who is our acting health official for the state of California. They recently held a webinar for school officials, and it was very interesting in how Dr. Galley explained that younger children do not have the number of transmitters on their cells to transmit and spread COVID-19 as older folks do. And so with our younger children, the likelihood of them catching COVID or spreading COVID is much greatly reduced as compared to older students or young adults. And so with thinking that and knowing that information, that scientific information, and then understanding all the protocols and procedures that we have in place that are protective factors to help reduce the transmission of COVID-19, we feel very comfortable with our students beginning, our youngest students beginning on December 7th. So with that, today we're going to review some of our health and safety protocols for students and staff. And I'm going to start with Director Skaden. And Susie, can you first review with us the most important aspects of our protocols?
Sure. I think the most important parts of our protocols is that everyone follows the procedures that we have been put into place for the health and safety of all. The protocols cover several basic areas. First, we want everyone to make sure that they are feeling healthy when they come to school. We're asking everyone, staff and parents, to do a quick daily COVID self-check on themselves or their child before coming to school. Our general health hygiene practices, such as hand washing and use of hand sanitizers, are in place. We are asking staff to establish hand hygiene routines, such as every time a student enters the classroom, after they do certain classroom activities and such. Basic practices would also include classroom hygiene and cleaning. There will be classroom fogging between the AM and PM sessions, and wiping down of shared surface touch points like doorknobs and light switches and that type of thing. Maintaining social distancing will be very important. Classroom furniture has been moved and areas are marked with space indicators for easy reminders to keep this social distancing. And Mr. Kerr will be discussing this later on.
Great.
But it's an important protocol. We also are requiring face masks to be worn by all staff and students unless there's a medical issue that would make it not possible. And we have face shields with drapes for the individuals as an accommodation if they need this alternative face protection. Every school has an isolation room or area where we will have sick children waiting to be picked up, and they will be monitored until they are picked up by their parents so they don't spread the germs to others in their classroom. We receive reports of anybody with a positive COVID test. We have contact tracers, which are all of our nurses on site. We have 49 that will do rapid follow-up response to any COVID test positive. We also have systems in place to notify parents and staff immediately when there's a closure or quarantine happening. We also have staff COVID surveillance testing, so that all staff will have a routine COVID test just to catch any asymptomatic staff that we may have on site. And there's lots of protocols in place with lots of details, but these are the basic ones that we have.
Well, thank you for sharing those. One of the questions that I keep getting repeatedly is the self-check that we're asking families to do with their students before they leave for school in the morning or afternoon, depending on their session. And also, we're asking staff to do that. And there's many symptoms we're asking them to check for, such as a runny nose, cough, temperature of over 100.4, stomach aches, those kinds of things. It seems like about everything except for a rash is on the list. I've been asked repeatedly, is it just one symptom? Is it one or more symptoms? But we're asking if you have any symptoms, even just
Right.
one of those,
Right.
runny nose, a cough, that you don't send your child to school, and if you're a staff member, you stay home.
Right. The one symptom is what the health department has told us needs to be the directive, because you don't know if it's COVID or something else, but you just can't take a guess at it and go ahead and come to work or school.
Right, and this is very different from in the past where perhaps if I had a runny nose, I might come to work, we kind of like tough it out a little bit. But really in the midst of this pandemic, we've asked people to flip their thinking.
Right.
So it really is, if you have any symptoms of illness, please stay home.
Right, and
Yeah.
there are the common childhood illnesses, which will still occur, but we just can't guess that that's what it is and
Right.
assume it's not COVID.
Yeah, so we want to be exceptionally careful in this environment. Well, thank you. Can you tell us a little bit more about face coverings and the other essential protective gear that's going to be used to keep our students and staff safe? We also get many questions about that.
Sure. It's important to know that the mask and the face shield protect both the wearer and the other people around that person from the respiratory spray, the droplets that come out of someone's mouth that would expose them to COVID. So the mask or the shield protects that and traps that, acts like a filter for those germs. We're requiring all staff and students to wear a mask at school. Some maybe won't be able to do that. They might have a medical reason that they can't wear a mask. And for those students, we have an alternative, a face shield. And the health department also asked us to add a drape to the bottom of it, so that would contain the spread, the respiratory spray. Of course, students coming to school, sometimes people forget their mask, like we all do. You hop out of the car and you left your mask in the car. So we do have disposable masks at school, should a student arrive at school and not have their face mask. All students will be provided with 2 cloth face masks from the district. So they will have those cloth face masks, plus, just in case of emergency, we can give them the backup face mask at school. Talking about the face shields, our special needs students occasionally need to have visual cues to see facial expressions or how the word is formed, that type of thing. So we would have face shields for our younger students, preschool, kindergarten, 1st and 2nd grade. The teachers will have face shields where they can provide instruction to students. Also, our speech therapists and special ed teachers may have those face shields so that they can see their face while they're talking but still keep the kids safe.
Okay, well, thank you. Another question that we get frequently is about health screenings for students and staff and what that's going to look like. And I know we've covered it before here in some of these Q&As, but would you please go over that again? I think we've added more details as the weeks have gone on.
Yes. A daily COVID check is done by parents for their child and by all staff members. So before they come to school, they will do this check. On our district web link, we do have information where it spells out exactly what symptoms to check in your child. And also, if you've had any recent exposure to somebody that tested positive for COVID, that you should not be coming to school, or if you've been told to quarantine or stay home away from others, want to make sure that you're doing that as well. Sometimes people forget that last little step, and they knew like somebody was at a party or a relative, and they just didn't think that that would affect them. Yet if they had close contact, they need to stay home.
And how would you define that close contact? Indoors, no mask?
Right. It's an extended period of time, anything over 15 minutes.
Okay.
You're very close, you're closer than 6 feet, and maybe you're not wearing a mask. And so if you're close and extended periods of time, that's not a safe practice, especially like in party situations or group gatherings. It's best to wear your mask and keep social distance.
Okay.
Also, when they arrive at school, I left this part out, when they arrive at school every morning, a staff member will be at the gates as students enter, and they will be performing a visual wellness check of the children as they enter, and also asking them how they feel. And so as kids come onto campus, they're looking healthy, they're feeling healthy, they're welcome to go straight to class. But then if they're not feeling so well and they tell the staff member that, no, I'm having a bad day, no, my stomach hurts, or whatever reason that they aren't feeling well, or they look like they don't feel well, they would be sent to the nurse and given a full COVID check, including a scanned temperature, before they go to class, or they'd go to the isolation room to go home.
Right, and that's another reason I think parents need to be aware of these protocols, because if a student isn't feeling well and then the nurse checks them out and they're not able to go to class, the parent's going to need to come pick them up, and so it would be best not to bother sending them in the first
Right.
place, because they're not going to be allowed to go to the classroom.
Right.
Well, thank you. We also have questions regarding contact tracing, and I know we have 49 school nurses who are trained in contact tracing. So can you tell us a little bit about really what contact tracing is, how it works, and how does the Tulare County Health Department, which has been a great partner for us as a school district, how do they interface with us? Like, how does that relationship work when we're doing contact tracing?
Okay. Contact tracing, you hear people talk about that all the time. It's basically just a COVID disease investigation. That's what we're doing, is investigating who had this and how is it going to be spread amongst the population. So in Visalia Unified, our school nurses are the identified contact tracer at every school site. So with their training in this area, they follow the set guidelines from the health department and the CDC. They receive a case of a positive COVID. They investigate all of that person's contacts. Basically, who has that person been around? Were they in close contact? Were they wearing a mask? And any type of contact they may have had. That's why we are keeping our student groups small, so that should we have a positive case, it only affects a very small group of students instead of the whole school. So when you only have 16 students in a classroom, that's the 16 that would unfortunately been exposed, but it's better than having them like both classes mixed and having 32 classes, or the entire second grade having exposure to COVID. The nurses, they look at who they were in contact with, were they wearing a mask, were they close, and then go from there. It's a case-by-case situation, because you may have had close contact in some instances, not so close in others, and so the nurses are able to follow the guidelines and determine, does the class need to be quarantined or not. We've been told by the health department that more than likely, if there is a positive in a classroom, the whole class would be quarantined for 14 days, just for the safety of the students. Quarantine would mean that they would stay home for 14 days, and the parents would monitor for signs and symptoms of COVID, make sure their child's feeling okay.
So the teacher and the students would be home from that particular classroom, and then from the educational point of view, we would just switch that classroom back to distance learning. The teacher would instruct from their home, and the students would do what they're doing now.
Right.
Yeah. Okay.
Right. And how they work with the health department, in answer to the second part of your question, is that they would report their contact tracing findings, who the person was around, how long, wearing a mask, send that to the health department, and at the health department they have assigned staff specifically to schools, and they will look at that, give us additional advice, additional quarantine, additional school closure, whatever they feel is necessary for the health of the population, and share that with us. They would also do the additional community tracing, say like for the parent, where the parent had been, if perhaps they got the COVID from their family members.
Okay. Thank you. I'm going to switch gears now a little bit and talk to Eric Kerr, our Chief Operations Officer for the district. Eric, one of the aspects of keeping our students and staff safe is really that physical distancing of 6 feet or more. Susie talked about the mask wearing and the hand washing and sanitation. But we know that we're going to need to have that physical distancing like we all are right now.
Right.
Can you tell me what the staff has done to arrange furniture in ways that contribute to helping our students and staff maintain that 6 feet of social distancing?
Sure. Thank you, Dr. Evelyn. For the past several weeks, the school sites and our custodial team working very closely with the school sites, they've been working to remove the excess furniture from the classrooms, and that's based on the number of students that are going to be returning for in-person learning. The desks in the classroom have been placed to allow for a minimum of 6 feet between each student, and the student materials are either kept on the desk or they're kept in an individual, either a bin or a packet for the students, so each student has their own set of materials and they don't share. The teachers and the site staff have really been working very hard, and some of them have been really creative in how they set up the rooms to really allow for this 6 feet of social distancing. I'd like to share a few photos just from some of our elementary sites.
That would be great.
Yeah, and give you an idea, and most of the sites are set up this way, or some version of this, very similar. So this is an elementary site. You can see they've got an individual desk for each student. This particular classroom, I think I'm seeing around 12 desks. On the floor, maybe more, there's some in the picture in the foreground. On the floor, they've got tape marks so that we can keep the desks located the appropriate distance. This particular classroom doesn't have the bins at the desks, but as we've done inspections at all of the sites, the classrooms sometimes have them in a separate area where the kids can go over and pick them up and then take them back to their desk. Here's another site. This, I think, is our Four Creeks Elementary. So there's some slightly different layout here. This particular classroom has 2 chairs, but really it's just so that they can kind of keep the spacing so that the kids don't move the chairs around. They've got kind of welcome back, and in this particular case, the materials are placed on the desk different, but this is just another example of how our sites are being really creative. In this particular site, slightly different layout again. You can see there are bins on the floor with the student materials, and this particular teacher has gone out of their way to provide a water bottle for each student. So that would be their water bottle, so they're not, as our drinking fountains are closed, the students will have to refill those reusable water bottles. And so just another different level of kind of how they're being creative to set it up to keep the students properly distanced. Again, here's another example. See, this one has tape on the floor to keep the desks. The desks are aligned here. This particular teacher has a slightly different way of providing the materials. See, each desk has a Chromebook in a case, along with some other materials. So, but again, the theme here is that the students will keep their distance. They're 6 feet apart. And the teacher will, on the first day, make sure they cover with the kids kind of this classroom management, how they'll come in, how they'll line up outside, and they'll all go to the same desk. And then this is just an example, this final slide here, of a bin. This looks like a laundry basket to me, which is a great way to kind of keep all the material together for the individual student. It gets ventilation so that our foggers will be able to penetrate and be able to disinfect the materials that are in there so that they're ready to go for the next day. So this is just another example.
Well, those are great. Thank you for sharing those. I
Sure.
like the laundry bins. And you talked about the foggers and such.
Yep.
Along those lines, we have received so many questions about ventilation.
Right.
And the ventilation that we normally have is probably sufficient. But then on top of that, we purchased the HEPA air filters.
Right.
Or air purifiers.
Correct.
So can you explain, starting maybe with our HVAC system, our
Sure.
heating and ventilation, air conditioning systems, like how that works and how they contribute to healthy air environment, healthy air quality, and then how the HEPA filter is going to even make that even more so.
Sure. That is a great question, and the ventilation and filtration question is one that all of us get a lot. It's probably one of the most frequent questions that we receive. But really, we're following the current guidance, and we start our systems 2 hours prior to any occupancy in a classroom. So if a classroom is first occupied by a teacher at 8 o'clock, the system will start at 6 a.m., and we run it continuously. We run the fan continuously for up until 1 hour past when the occupancy ends. Probably those fans are run continuously instead of just during the heating or cooling cycle of the unit. So if you think about your system at home, typically in the summer, the air conditioner kicks on and the fan kicks on at the same time. And in the wintertime, or now, when our heat kicks on, the fan kicks on. But other than that, it's probably quiet, unless you're an exception. That's how typically most home systems run. We've to allow for continuous ventilation during the occupied periods, we've turned the fans on continuously, so the fans never stop. They are running all the time, whether the unit is actually producing heat or cool. And so what this does is this allows us to ventilate continuously, even if the teacher's not in the room, it's continuously turning over the air. Our systems are designed to turn the air over a minimum of 3 times per hour. And our maintenance team, performs routine maintenance on the HVAC systems, and that includes changing the filters regularly to make sure that they're operating within their design standards. So that's for our HVAC system. That's how it's really about ventilation and increasing the time that we ventilate instead of just when the system is heating or cooling. We ventilate continuously from 2 hours before occupancy to an hour after.
And that running a fan continuously, is that a change?
Yes.
From our normal procedures, which would be more like home where
Yes.
the fan kicks on?
Correct.
When the temperature needs adjusting?
Correct.
Okay.
Correct.
So that's one part, and then on top of that, we purchased, I can't remember the number, it's hundreds, maybe thousands now, I'm not sure, of these HEPA air filters.
Yes.
Or air purifiers. Can you
Correct.
explain how those add an additional layer of protection?
Yes. This is probably one of the things I'm most proud of in the short time that I've been in this role, and we're really excited. The district purchased 1,700 HEPA air purifiers, and that's one purifier for every classroom in the district, every nurse's office, every isolation room, and we'll still have some left over for some other spaces. We've added some for some of the smaller kitchens in our district where the space will allow. And I'm also pleased to announce that we received the first 720 on this past Monday, and as of about noon today, we've deployed them into every classroom that is going to be occupied by children starting on Monday, the 7th, and the remaining 3rd through 6th grade classrooms will be deployed the following week so that they're ready to go by the 14th.
That's amazing, because we just got them Monday, didn't we?
Yes.
Yeah.
So 2 days, they deployed, our custodial team, utility team deployed over 400 units in 2 days to multiple sites.
That is great. So every classroom
Yes.
that is preschool, TK, first and second has those, as well as the nurse's office and sick areas.
And our returning cohort classrooms
Okay,
that are
all right.
returning at our middle and high schools, in select middle and high schools, as well as our special ed programs that are continuing again. We've collected this data from all of our sites, as well as our administrator for special ed, to make sure that we've got all of the rooms, and we've had to kind of call some audibles the last couple of days, but our custodial team has been up to it, and they've just kind of diverted and added an additional unit here or there to make sure that we have all the rooms covered.
Thank you so much.
Sure.
So can you explain a little bit how the HEPA filter works?
Yes, sure. So the HEPA filter is an additional layer of filtration over and above the filter that's in the HVAC system. And so each filter contains a HEPA 13 filter, which is a medical grade filter. Each purifier will service an area of up to 1,300 square feet, which is why we put one per classroom, because our average classroom in the district is about 960 square feet. So each HEPA filter, or each purifier, will more than adequately change the air over, filter 100% of the air every 30 minutes. The filters, this HEPA 13 filter that all the units have, will filter particles down to 0.1 micron, which is very, very tiny. A COVID particle by itself is about 0.125 microns, so it's slightly larger than the smallest particle that the filter will filter out. And so it's about 99.9% of all particles will be picked up by these filters. One other nice thing about the filters is that they're designed, the filters are replaceable. They're designed to run for 24/7, and we'll get about 12 months out of each filter, so we don't have to change them that frequently. And so the district has already ordered an additional set of filters for all 1,700 of those, so we'll have a backup in place. And we're looking at a process whereby we can make sure we always have filters in stock, kind of a subscription, and getting a better price from our vendor on that. So we're very happy with the filters. I've seen them. I turned one on the other day and we tried it. It is very quiet. The fan automatically changes its speed based on how much filtration it needs to do on the air. It has a sensor, built-in sensor. So if the air is very clean, it has a particular color. There are 5 colors on the unit. It tells you how clean the air is. Once it gets to the blue, which is the cleanest, the fan is very, very quiet. It's more quiet than the air conditioner here in this room. And so they're really very simple to use. We've sent out a infographic to all of staff with instructions on how to use it with pictures rather than just words. Makes it much more user-friendly, and so we're really excited, and so far the response that we've heard of the few teachers that have turned them on and they're in their classrooms right now has been positive. So.
Okay, well, thank you for sharing that information. Just one other thing, I remember you talking to some groups and talking about how this would really help our air quality in our classrooms throughout the school year, beyond the pandemic.
Right.
So our plan is to keep them running?
Yes.
All the time?
Yes.
So things like pollens, smoke from wildfires.
Right.
All the dust, all those
Correct.
kinds of things we encounter living
Yes.
in the valley. It'll help filter all of those as well.
Right. We upgraded the filters that are in the units. It has a carbon component, which is specifically for odors and high concentrations of particulates and smoke, which will not necessarily help us this time of the year, because the HEPA part is what filters out the pathogens. The carbon part is what pulls out the odors.
Okay.
And so the company has several different levels of the same HEPA 13 that do different things. The one we've selected is called, I believe it's called Fresh, and it filters out the additional smoke and particulates which will really help us during wildfire season. So yes, we plan on keeping these going forward. We think it will really help with the indoor air quality well past this pandemic, and really will help with, especially those that may have some respiratory sensitivity, could provide that extra layer of protection, filtering out those extra particulates in the air.
Well, thank you, and thank
Sure.
you for sharing those photos with us. Appreciate that. Susie, I know we talked about the symptoms of COVID, but let's review them. I kind of rattled off a few, but
Okay.
if a student or staff member has symptoms, we know they shouldn't come to school or work. Can you remind us of what those symptoms are, please?
Sure, there's a lot of them, so hang on.
Yeah, okay.
We have fever, which not everyone has a fever with COVID, but that's one of the many symptoms. And the fever is something that they're checking at home each morning before they come to work or school. A cough, shortness of breath, headache, sore throat, runny nose or congestion, fatigue, nausea or vomiting, diarrhea, new loss of sense of taste or smell, and muscle pain or chills. So you can see a lot of that is other illness, but like we talked about previously, we just have to be careful.
So if I'm a staff member or a parent of a child that has these symptoms, I know now not to send them to school or to go to work if I'm a staff member. What should I do, though?
Best course of action is to call your healthcare provider and see if they want you to have a COVID test. That's the best course of action. If they have these symptoms, and it could be something else, make an appointment with the healthcare provider, go get checked, and if it is something else, they can give you an alternative diagnosis, give you a note of when it is okay to return to school, and they might also have you get a negative COVID test before you return. But whatever they advise, then you can get your child or yourself back to school or work sooner if it isn't something directly related to being exposed to COVID.
So it's really preferable to call my healthcare provider rather than just go, like Korea Delta has free COVID tests and that sort of thing. If I'm having symptoms, I really should contact healthcare.
Right. If you are having a symptom, that's the best case, is to ask your healthcare provider next steps. We do have those occasionally that don't want to go to their doctor and be tested, and they're saying, it's just a cold. I'm not going to go to my healthcare provider. We have to treat those cases as if they're positive COVID. So they would have to stay home for 10 days if they choose not to go to the doctor. So best thing is to go to the doctor. You can come back sooner or find out if you do have COVID and need to stay away from others.
Okay, well, thank you. Is there anything else that either one of you feel we need to review today in the areas of health, sanitation, ventilation?
Our cases in Tulare County and California are rising. We're all aware of that. So it's just like this whole session, wear your mask, keep social distancing, and avoid crowds if at all possible.
And thank you for that reminder, and thank you all for joining us. It is imperative that we all follow the public health guidelines and wear our masks in public settings, maintain that 6 feet of social distancing, and avoid social gatherings as much as possible. It's important that we all do our part to bring the numbers back down so that we can open up our schools fully. We are able, even though we're in the purple tier and the numbers are rising, we are able, with the guidance again, of course, and support with our health officials, to open up our schools because we have the elementary school waiver approved with all those procedures in place, some of which we've talked about, but there are many more. If you're interested in looking at those, I invite you to go to our webpage at VUSD.org. Our reopening plan is on the top of the webpage in English and Spanish, and if you scroll down just a little bit, you'll find our elementary school waiver that was approved. Increasing our protective factors is the way that we can reduce the spread. Again, those protective factors of wearing a mask, social distancing, avoid social gatherings, which will allow us to open up our schools for our older students as well. We cannot send our middle school and high school students back to school until we are in the red tier for a couple weeks. There is no waiver. I get asked that question a lot. How come there's not a waiver for middle school or high school? There isn't one, and so we really all have to work together as a community and as a region to try to bring the numbers down. So and thank you for helping us do that. As a reminder, these sessions are recorded, so you don't have to watch us at 4 o'clock if you're not able to. You can go on our YouTube channel, just Google Visalia Unified YouTube, and you'll find all of these recorded sessions. Thank you, and take care of yourselves and each other.